Hi everyone, Chris here and welcome to MP Sparkles. Today we are going to cover a very important subject, which is a population of the most vulnerable. Nope, they're not children or babies, as they are cared for by adults. We are going to talk about the elderly. My hope is that my videos bring you some good insight, and if you enjoy them, I'm not asking you for money and I'm not asking you for one of your kidneys, but you might like to subscribe or share it with some of your friends or colleagues, and even hit the like button, as this would help me a lot. In return, I will talk to you about subjects that are sensitive as far as skilled nursing facilities. I am happy and open to receiving comments with any questions or concerns that you have, and we'll try to tackle it together. So let's talk about the elderly people. You have to know one thing, that these are people that have earned the right to be treated with care and with respect. They have earned that right. They have lived a life and a life full, and now all of a sudden they find themselves dealing with different changes that they had not planned for. What you may see as a grumpy person, for example, or someone who's just ornery and belligerent, is a person who once upon a time had dreams, just like we do. They had hopes. They were hoping that their old age would be maybe shared with family, or maybe shared with a loved one, or maybe have a big house or modest house and maybe a pet. They had a lot of plans for their future. Now, imagine that as they got older, all these plans changed. Maybe they lost a spouse. Maybe they're not able to walk anymore. Maybe they have some mental health issues, and their loved ones, if they have a family, is not able to take care of them at home. And therefore, they transition into a nursing home. Now, imagine the kind of trauma. Imagine how your hopes of maybe sleeping till noon one day, or taking walks, or driving around to see the beautiful leaves in the autumn, everything gets shattered. So at some point, somebody decides that they're not allowed to drive anymore. And with the removal of a driver's license, try to imagine what comes with. So you remove somebody's driver's license, that is a complete loss of independence. What are they going to do? Now they depend on others for all of their needs that are not related to being in the home. Once they're transferred into the nursing home, now they're no longer able to make decisions, because even if a resident of a nursing home is his or her own person, they can't decide, I'm just going to take a walk and go out to the grocery store. They can't decide that for themselves. They might be sharing a room with somebody who has advanced dementia, or somebody who's scared, or who screams, or who does not have the same habits as they do. They might get woken up 4:30, 5 a.m. by staff who has to get all the residents up and going. It's not what they dreamt about. That wasn't their initial life and their initial dream or goals for their future. It was not. Imagine for just a second getting woken up by somebody who walks into your room, flicks on the lights, and takes the blankets, takes them out, and starts moving you out of bed. Come on, it's time to go. Good morning. I don't know about you guys, but I think the papers would probably read about me the next day. It's just not what I'm planning. And these elderly people have no advocates. They have nobody to speak up for them. Even if they do have family, the family entrusts that the nursing facilities will take care of their loved ones because they're not able to. And sometimes it's not always like that. Then, once they get all dressed up in a rush and quickly, they're placed in a wheelchair if they're unable to walk, and they are placed in the hallway. And there they wait for a long, long time. They wait for the nurses to bring them their medications, or they wait to go to the bathroom. They just are there at everybody else's schedule, and they're not on their own schedule that they would probably rather choose. If they go to the bathroom or they need to go to the bathroom, I apologize. They might not be able to for maybe 15, 20 minutes, 30 minutes until somebody can come there and help them out. Now, 20 minutes or even 10 minutes, maybe for us is not a long time, but for somebody who is sitting in a wheelchair with a bladder that's filling up or worse, having to wait that long could be very uncomfortable. Or if they need water and nobody's around, or the aides or the nurse says, okay, we'll get you water in a few minutes. And I ask myself, why do people have to wait a few minutes for water? Why can't we fill their cups when we go in and take care of them, make sure everything's done? Many times it's like that, but sometimes, unfortunately, it's not, and they have to wait a long time for a sip of water. But let's not forget, these are human beings. They're people. They have feelings. They feel alone. They feel scared. They're angry and they're anxious and they go through a lot of different emotions. But I ask you something, wouldn't you? Because I would. Many of them have probably worked their whole lives making these huge, huge sacrifices, and they may have endured pain or violence or abuse or even rejection. And so right now, being there, they have really nothing to look forward to. So let's change that. Let's change that and make their life a little bit better. I understand, as I've spoken to in my other videos, about understaffed, way overworked, way underpaid. I get that, but that cannot be an excuse for not making even the smallest difference in a person's life. These could be your grandparents. This will be you one day. It will be you. These could be your parents. What kind of care would you like for your parents or for your loved ones when they go to a nursing home? And if you see some of these people who are just burnt out and they just don't belong there anymore, my question to you is, would you like somebody like you to take care of you when you become elderly? One thing about older people that you need to understand, especially if you're very young, is that they judge. They were born in a different generation and they don't understand the privileges that youth has nowadays. And therefore, they might judge your tattoos. They might judge your piercings. They might judge you because, you're 12 years old. How are you going to take care of me? They have a lot they pass a lot of judgments. However, you can prove them wrong in actions. Show them that there's something beyond whatever your body's showing or whatever is different, the color of your hair, it doesn't matter. Show them through caring that you are a person of value and that you will take good care of them and they will trust you forever. And we do that by earning their trust. So how can we earn their trust? Because they're not always easy. So what I like to say is, don't ever talk the talk if you can't walk the walk. Just don't do it. Do not promise them that you'll be right back if it's going to take you 20 minutes. The worst thing you could do is say something and not follow up or follow through with it. A lot of times, patients don't care if you don't know something. Like if they ask you a question and you're not sure, you can't just fib yourself into giving answers. You want to be as truthful as possible. But if you tell them you don't know, I don't know, but let's look at it together. Do you want to, let's Google this together? Or if they ask you for anything that you might not know, just be honest and tell them you'll get back to them, and get back to them as soon as possible. Tell them the truth. Tell them, I just have a couple of things that I need to finish, but I will be back. I'm not going to tell you it's going to be 5 minutes because I don't want to break that promise to you. So when I say something, I mean it. So if you give me just a little time, what can I do in the meantime to make your life better? No, it sounds redundant or it sounds ridiculous, but it really has a deep effect if you ask somebody, what can I do to make your life better? What can I do? Would you like some water? Would you like me to turn on the TV? Do you want me to come in and talk to you? Do you have some things that you want to get off your chest? Like, offer something that they could feel like they're not abandoned and they're not just there and nobody cares for them. One thing I will tell you is, do not ever, and I mean ever, tell any of the residents how understaffed you are, how busy you are, how bad your life is, how uh, you're tired. It's none of their business. They're not your shrinks. They're not your therapists. They're not your friends. They're not here to listen to your problems. Look at where they live. So we are here for them. If you have a bad day, leave it at home. Leave it in the hallway of your nursing home. Do not bring it in the rooms. It happens to me sometimes. I'll go see one of my patients, and he or she will tell me, I had to go to the bathroom and it took a long time last night. But that poor girl, she was so busy, and she told me they have no staff. So it was only her and one other person in this whole facility. I don't want to hear that. That's cruel. That's not fair. You're asking an elder to have understanding for you? No, no, that's where you contract with your management. That's where you go there and tell them these people are not getting good care because we don't have help. You advocate for them. You don't use them as your personal therapists or your personal people that you could just vent out to so that your day gets lighter. And then they acquire anxiety because now they're worried about you. The other thing is, always greet them with kindness. You go into the room and you just say, hi, good morning, how are you doing today? You look lovely. Maybe pay them a compliment. It's not being fake. There's probably, certainly something beautiful about them. So compliment them and keep your voice a little bit low, unless, of course, they're hard of hearing. In that case, you have to scream. But if they can hear well, don't go in screaming. And I have to leave my high tone at the voice at the door too, because I'm Italian. And by default, I am very loud when I talk. So I make a mental note and tell myself to tone it down before I walk into a patient's room. The other thing is, try not to talk bad or gossip about your colleagues, especially to the residents, but even amongst each other, because although you think you're just talking to some of your colleagues, the doors are open and these people can hear everything. And then it gives them concerns because they're hearing things that they should not be hearing, perhaps. And you have to be very careful. And if they do overhear a conversation that another shift had, or some nurses or staff or aides or whoever have, apologize. Just say, I'm very sorry that you had to hear that. That was inappropriate and that will not happen again. Are you okay? Do you need to talk about it? Just have some empathy and compassion and see if this is causing them a lot of anxiety, because it could change their behavior as well. And the next thing is, get to know your people. Get to know your elderly people. They are so interesting. They were maybe engineers, or they were lawyers, or they were brokers, or they were teachers. They have stories. So get to know about them, get to know about their families or their stories, or ask them what's the funniest thing that ever happened to you, or just get into the conversation. Also, while you're getting to know them, get to know what their likes are. Do they like their water ice cold? Do they like their water room temperature? Do they not like water? Or what would they like, pudding or apple juice? Get to know them a little bit, and make a note, because you going into the room and saying, "Hello, Ethel, I brought you your favorite icy cold drink," will make a huge difference for them, because they will think, "Wow, she remembered and she cares about me." And that is really important. The other thing is, don't call them hun, honey, dear. They're not your honeys, they're not your dears. In time, when you get to know them, you can say, "Hello, love," but dear and hun and honey, they seem a little condescending. I know most of you do it out of habit, and you don't do it at all to be condescending, but they have names. So if you meet somebody for the first time and you tell them, "Hello, Mr. Smith," what would you like to be called? Would you like to be called Arthur, or would you like to be called Mr. Smith? And for a while, keep it like that. And then always give them that respect. You walk into their room, "Good morning, Mr. Smith," or "Good morning, Arthur. How are you doing this morning?" Because it's easier. The other thing is that elderly people are not babies. So we don't tell them, "Oh, does your tummy hurt? Do you want to go potty?" Potty, they're not 5 anymore. Do you need to use the bathroom? Do you need to use the commode or the toilet? Is more appropriate for that age. Unless, of course, that's the language they use. If a resident says, "I need to go potty," or "My tummy hurts," then that's fine. You can inquire, "Where does your tummy hurt?" But if they don't say that, then you don't say that either, because it's not necessary. And remember that because they don't have family in the facility where they're at. Their family might be home, they might visit once a week or even every day, but they don't have family there 24/7. And so you are the only family they have. So if you talk to them with respect, or you greet them kindly, and especially advocate for them and make sure they're comfortable, make sure they're well taken care of, then they will talk to you. They will have this relationship that they will trust you. So when you tell them, "We need to take this medication," if they had been refusing it with other nurses, they know that you have their back. You want the best for them. And for you, they will take that medication. When you're training a new nurse, or not a new nurse, but a nurse in the nursing home, do not ever talk bad about residents. Don't ever do that. Just don't, because one day that could be you, and somebody's, "Oh, look at that lazy person." We don't do that. It's really unnecessary. Describe each resident as best as you can, so that the new person can come to get to know them. The problem is, if you already say negative things about them, the new person that comes there will be like, "Oh yeah, that's the lazy one." Okay, that's not fair. Just because you're setting them up for failure, they're not going to be as kind or as attentive if you've already dismissed them to the new person that you are training. When you are in training mode, you need to train. You cannot set up people for failure. You need to train them as best as you can. And do tell your managers, "On training day, I need to be training." So maybe that day will not be a day that you are on the med card all day. It has to be a day where you have time to show this person where the faxes are, where do you get them, how do you find this, how do you find that. It's really difficult to do when you're on a med card giving medications, then that one falls, then this one died, and you're constantly, imagine how the new nurse would come on board saying, "Oh my goodness, I could never do that." And that's not fair either for either of you. Sometimes if you see a resident and they're grumpy, just leave them be and come back, or ask them, "What can I do to make things better?" or give them a hug. Touch is very important, not inappropriately. You ask for permission, but if sometimes somebody just needs a hug and then things are better. On the other hand, if you have a resident who makes a lot of allegations, like somebody stole this or somebody abused them in any way, do not ever, ever go into the room by yourself. Whether you're a nurse, bring a CNA with you. If you're a CNA, bring somebody, anybody with you, because there have got to be two people to witness that whatever the resident accused them of did not happen. Otherwise, there are allegations, they have to call the police or investigate. It becomes a very long thing. So if there is anybody who makes allegations, please keep yourself safe. And I have one final thought to the nurses as well as the nursing assistants, but nurses can do cares, and we should be doing cares, because when we do cares, we get to see a person's body. If there's anything going on, if there are any injuries or scratches, maybe the CNAs won't tell you. Maybe they're busy. Maybe they don't like you. Maybe they didn't see it or they didn't look for it. So you are responsible for anything that's going on in this patient's body or skin or anything. But when you do cares, leave them their dignity. So if you're doing pericare or anything in the area, put a sheet or a blanket, cover them halfway. You cover them from here up to their waist so that you can do the lower areas. And if you're working on the top, then cover their bottom. Do not leave them all naked and on the bed. It's so undignifying and it's so embarrassing for a lot of these people. And then they get used to it, but it's nothing that you really need to get used to it. This should be something that we have to think about for ourselves one day when we are there. How would we like to be exposed and just with everybody in the room? We probably would not like that at all. So I hope that this helped you a little bit. I hope that this video gave you some good insights. I'm not here to judge. I just see things, and as far as the nursing homes, what I see sometimes breaks my heart. Some of it could be not on the caring end, but on management's end. But some things I see just break my heart. And I urge you, if you're choosing a nursing home, whether it's because it's your choice or whether it's because it's your first job and nobody else will give you a job, please just be very considerate of these people. They don't want to be there. They did not plan for this. This is their life. This is how they end up. And, I'm going to say something right now, so take it for whatever it's worth. But with the way cares are today, I'm thinking that when I get old and there's a plan for me to go to a nursing home, if they were like they are today, I would buy a brown suit, put a pair of antlers, and have somebody drive me to the woods on hunting season and hope that would be the way that I would go. So with that said, I hope you enjoyed this video. You have a wonderful day, and do something caring for your elders. And if you want, post about it so that we can all cheer you on. Have a great day.